Now coming to fenestration. This fenestration is nothing but a communication between systemic venous atrium and the pulmonary venous atrium. You have the conduit which goes into the pulmonary artery. By doing this fenestration, you create a pop-off so that the pressure in the circuit comes down. By doing this, you bypass the lung and directly fill the ventricle. Here the conduit is there. The blood, instead of going into pulmonary artery, comes into the ventricle directly. So it increases the volume of the ventricle. But at the same time, it bypasses the pulmonary artery and deoxygenation. It does not fill the lung, but instead fill the ventricle, and some deoxygenation will happen. So how much fenestration to be created? Less than 15 kgs, you go for a 4 mm fenestration. Between 15 to 30, you go for a 5 mm fenestration, and if the weight is greater than 30 kgs, you go for a 6 mm fenestration. And what are the various indications for fenestrating the Fontan? When you have high pulmonary vascular resistance or mean pulmonary artery pressure, your pulmonary artery is disordered due to previous BT shunt, when the ventricle is poor, systolic or diastolic dysfunction, and lot of atrioventricular regurgitation. Here, by doing the Fontan, you lower the venous pressure, you lower the Fontan pressure. By lowering the Fontan pressure, you maintain the cardiac output. The blood from the circuit directly bypasses the lung and goes into the ventricle, thereby your cardiac output is maintained. And desaturation can happen if the fenestration is too large, and you should not allow the saturation to fall less than 75%. At the same time, spontaneous closure can happen if the fenestration is too small. By creating this fenestration, systemic embolization is a potential risk. Here, the Fontan circuit pressure is around 17 mm of mercury, and you are LA or indirectly the LV-EDP is around 5 mm of mercury, and the saturation is around 95%. Now you have a low cardiac output because the filling pressure is high. The cardiac output is 1.8 liters. By creating a fenestration, you create a fenestration. Now your Fontan pressure comes down. From 17 it comes down and it goes into the systemic ventricle, and the ventricle pressure increases from 5 to 7, and this increases your cardiac output to 2.4 liter because the volume is diverted to the ventricle, but at the expense of deoxygenation. There is going to be little bit hypoxia because this blood is not getting oxygenated and it is not going to the lungs. So the saturation comes down, but cardiac output increases. And this is the MRI of the fenestrated Fontan. Here you can see the fenestrated blood going from the circuit into the systemic ventricle. Here you can see the fenestration going from the atrium to the ventricle. Sometime if fenestration is large, you have to plug the fenestration, for which a balloon catheter is inserted via the IVC into the conduit, and in the conduit you have a plugging device which opens up. First you have to cause the fenestration, open on the other side, then you have to plug on the both sides. This is usually done when the hypoxia is very severe.